Welcome to a presentation about increased floaters and flashes brought to you by your neighborhood doctors. Please remember that we will cover the topic in general terms. Please consult your doctors for specific questions pertaining to you. Floaters and flashes are like a bug in your eye. Imagine that you are looking at a bright light and suddenly a bug flies in front of your face. You can see the bug flying around, but it's hard to focus on it because it's moving so quickly. Floaters and flashes are like that bug. They appear suddenly and move quickly, making it difficult to focus on them. If you are experiencing increased floaters and flashes, it is important to be aware of the symptoms associated with this condition. Common symptoms include seeing small specks or strings in your vision, seeing flashes of light, or having a curtain-like effect in your vision. You may also experience a decrease in your overall vision, as well as difficulty focusing on objects. In some cases, you may even experience headaches or eye pain. If you are experiencing any of these symptoms, it is important to seek medical attention right away. Floaters and flashes are common eye conditions that can affect people of all ages, genders, and ethnicities. However, certain demographics are more likely to experience these symptoms than others. For example, people over the age of 50 are more likely to experience floaters and flashes due to age-related changes in the vitreous humor of the eye. Additionally, people with diabetes or high blood pressure may be more prone to developing these symptoms due to changes in their blood vessels. Finally, people who have had cataract surgery or other eye surgeries may also be more likely to experience floaters and flashes due to changes in the structure of their eyes. Floaters and flashes are usually caused by age-related changes in the vitreous, the gel-like substance that fills the inside of your eye. As you age, the vitreous begins to shrink and pull away from the retina, which is the light-sensitive layer of tissue at the back of your eye. This can cause tiny pieces of protein or other material to become suspended in the vitreous, creating shadows on your retina that appear as floaters. Flashes are caused by traction on the retina when it is pulled away from its normal position. In some cases, floaters and flashes can be a sign of a more serious condition, such as retinal detachment or retinal tear, so it's important to have them checked out by an eye doctor. If you are experiencing increased floaters and flashes, there are a few treatment options available. The first option is to simply observe the condition and wait for it to improve on its own. In some cases, the floaters and flashes may resolve without any intervention. The second option is to use laser therapy. This involves using a laser to break up the floaters in the eye, which can help reduce their visibility. The third option is to have a vitrectomy, which is a surgical procedure that removes the vitreous gel from the eye and replaces it with a saline solution. This can help reduce the number of floaters and flashes in your vision. Finally, if you have any underlying medical conditions that may be causing your symptoms, such as diabetes or high blood pressure, your doctor may recommend treating those conditions first before considering any of these treatments for floaters and flashes. The prognosis for increased floaters and flashes is generally good. In most cases, the symptoms will improve over time without any treatment. However, if the symptoms persist or worsen, it may be a sign of a more serious underlying condition, such as retinal detachment or retinal tear. If this is the case, prompt medical attention is necessary to prevent further damage to your vision. Thank you for listening to this presentation brought to you by Talking Raymond. For information, check us out retinali.com/info. Be safe. Love you.